Pleasant morning to everyone. This is J.Merlin from Nutrition Dietetics Department, SFR College for Women, Sivakasi. In this video, we are going to see about the irritable bowel syndrome and its diet pattern to be followed. Irritable bowel syndrome is a common disorder that affects the stomach and intestine, also called the gastrointestinal tract. Symptoms include cramping, abdominal pain, bloating, gas and diarrhea or constipation or both. IPS, it is called as irritable bowel syndrome. It is a chronic constipation that you will need to manage long term. The common symptoms are alternating diarrhea or constipation, abdominal pain and bloating, but perception of excessive flatulence, sensation of incomplete evacuation, rectal pain and mucus in the stool may also occur. Colon is the part of large intestine. The large portion of the human gastrointestinal tract is approximately 5 to 5.5 feet long with the diameter of about 2.5 inches is located between the cecum and rectum. Mostly after the small intestine, it is continued into the large intestine. Once we take the irregular food pattern or not take care about the body health, it leads to gastrointestinal disorders and diseases. It is divided into 4 sections: ascending, transverse, descending and sigmoid colon. Only a small number of people with IPS have severe symptoms. Some people can control their symptoms by managing diet, lifestyle and stress. More severe symptoms can be treated with medication and counseling. IPS does not cause changes in bowel tissue or increase your risk of colorectal cancer. So, this is the bowel functions. The organ for storing waste products by elimination of toxic waste material from our taking food or other materials in the form of stool, reabsorbing water from waste and maintaining water balance in the body, serves as the site for the growth of beneficial bacteria and other microorganisms, which is helps for the human health maintenance. So, irritable bowel syndrome is not a disease, it is a functional disorder, which means that the bowel simply does not work as it should. IPS is a common disorder that affects the large intestine, that is colon, and it also causes cramping, abdominal pain, bloating, gas, diarrhea, constipation, as we saw in the previous slides. So, this is the prevalence rate in the international level. 3 to 22% of worldwide persons have IPS. Reasons for 20 to 50% gastroenterology visits. Prevalence among children and recurrent is 26%. Abdominal pain onset before age 35 to 40%. Onset age 35 to 50%. Female, mostly female have more IPS than the male. So, here is the IPS in our colon. The contraction of the colon muscles and the movements of its contents is controlled by nerves, hormones and impulsive in the colon muscles. These contractions move the contents inside the colon towards the rectum. During this passage, water and nutrients are absorbed into the body and what is left over in the stool. A few times each day contraction pushes the stool down to the colon, resulting in a bowel movement. However, if the muscles of the colon do not contract the right way, the contents inside the colon do not move correctly, resulting in abdominal pain, cramps, constipation, a sense of incomplete stool movement or diarrhea. So, this is the image for the differentiate the normal colon and the spastic colon, which is affected by a person with IPS. So, now we are going to see about the symptoms of IPS. Symptoms of IPS vary but are usually present for a long term. The most common include abdominal pain, cramping, bloating. As usual, we saw in a previous slide. Changes in appearance of bowel movement, changes in how often you are having a bowel movement. Then we are going to see about the causes of IPS. The exact causes of IPS is not known. Factors that appear to play a role include muscle contraction in the intestine. The walls of the intestine are lined with layers of muscle that contract as they move food through the digestive tract. Contraction that are stronger and last longer than usual can cause gas, bloating and diarrhea. Weak contraction can slow food passage to lead hard and dry stools. Nerve systems, and the next topic is nerve system. Issues with the nerves in your digestive system may cause discomfort when your abdomen stretches from gas or stool. Poorly coordinate signals between the brain and the intestine can cause your body to overreact to changes that typically occur in the digestive process. This can result in pain, diarrhea or constipation. The next cause is severe infection. IPS can develop after the severe purge of diarrhea caused by the bacteria or a virus. This is called a gastroenteritis and also ulcer. IPS might also be associated with the surplus of bacteria in the intestine. The next cause is early life stress. People exposed to stressful events, especially in childhood, tend to have more symptoms of IPS. Changes in gut microbes. Examples include the changes in bacteria, fungi and viruses which typically reside in the intestine and play a key role in health. Research indicates that more microbes in the pupil with IPS might differ from those in pupil who doesn't have IPS. The aim of nutritional care is ensure the adequate nutrient intake to guide the patients towards the diet that is not likely to contribute to symptoms and to explain the role of ordinary dietary practices in producing or avoiding gastrointestinal symptoms. A daily fiber intake 20 to 30 gram is recommended for the IPS. Additional fiber in the form of bulk laxatives may also necessary, and excess of wheat bran may exacerbate mild cases. As commercially fiber supplements are generally beneficial. Excess in dietary fat, caffeine, sugar and alcoholic beverages should be avoided because it was triggered for the IPS, and the fluidity of these measures use the anticholinergic and antidiarrheal agents may be necessary. Relaxation of stress reduction techniques may also be useful. So here, so these are the symptoms and causes of IPS, mostly caused by the microorganisms and some lactase and some other factors. Thank you so much for listening and watching. We will see about the next topic in the next video. Thank you so much.